Rejection is a part of every single person's life, on the sporting field, in relationships, and in school. But when your family rejects you, it can have a pointed and oftentimes devastating effect.
My parents and I are not really close anymore. When they found out that I was gay, I sort of immediately was detached and disconnected from the family.
Third-year medical student Omar Salman has taken the negative effect and energy from his family's rejection and turned it into a powerfully positive endeavor to ensure all patients, no matter their personal issues, can be heard loudly and clearly by clinicians.
I think a lot of the time what physicians have a difficult time doing because of all the time constraints is just really hearing the patient and knowing who they are outside of their illness. So I think for me, it's asking the right questions, asking questions where you're going to be uncomfortable even as the physician. We all have our biases, we all have our things that we're not comfortable with, we all have our things that we don't know as much about. And rather than seeing those things as other or seeing them as wrong or just different and undesirable, we should see them as opportunities for us to learn and to grow with our patients. And that's hopefully what I'll end up doing.
To change this mindset, Omar poured his energy into his work with the American Medical Association, the Medical Student Section, and the Minority Issues Committee to create conferences, papers, and set up lectures on how to diagnose and treat patients who are LGBTQ. In 2016, he crafted a resolution for the AMA that opposed blood donor discriminatory criteria for sexually active gay men. Instead, he proposed a science-based method of assessing risk for each blood donor. The resolution passed, and the AMA sent a letter of support to the Food and Drug Administration. It's all part of Omar's significant volunteering efforts.
To me, volunteering, it's just something that you do because you've been in that position those people have been in. And even if you haven't, you have empathy for those people that might be suffering from things like psychiatric illness or might be suffering from something like being removed from their home or not having as much money or as many resources to care for themselves or their family members.
Moving forward from his family's rejection, enjoying medical school, and headed toward a lifelong dream of being a doctor, Omar suffered a terrible setback. He was diagnosed with cancer.
Heading into my third year, so I was sort of preparing to be on the doctor's side of patient care. And then right before I got to that point, I was on the patient side. And I think no matter what anyone tells you about putting yourself in the patient's shoes, until you're that person who's scared, who's worried, who is facing all kinds of complications, whether it be from not doing anything or from the treatments themselves, you don't really understand what the patients go through. You don't really understand what they deal with.
There are few ways that can better prepare someone for a life of medicine than being a patient.
It's our job to help our patients, yes, understand the objective and the science and all of those types of medical things that aren't so fun to talk about. It's also our job to understand how they cope, how they understand their illness, what their social situation is like, who is there to support them, who is not there to support them, what they need from us outside of these are the chemotherapy drugs that you need and this is the procedure that you need.
Omar is happily in remission and studying at the Virginia Tech Carilion School of Medicine. Barreling through these obstacles, Omar Salman will become a physician with a conscience, informed by experiences he wishes no other person should endure.
I think for me, the rejection and the other problems that I faced, I could look at them as, well, I hate these people or, they, wronged me or whatever. But I'd rather look at it as, well, I've learned from that experience and there are other people out there who are like me facing the same things or similar things and they need help just like I did.